Have you ever wondered why many medical professionals remain skeptical about adopting AI in clinical decision-making? Far too often, clinicians start using AI tools with genuine enthusiasm, excited by the potential to improve patient care. But as they encounter limitations, inaccuracies, or tools that don't integrate well into their workflow, that excitement quickly fades, leaving them frustrated and hesitant to try again. Before exploring the reasons why this happens, I want to take a moment to emphasize something I mention in every presentation. There is a big difference between chatbots and task-specific AI tools. General AI chatbots are simply the latest and now most famous invention in the AI landscape. Yet, they are often mistakenly conflated with all AI technologies. These chatbots are designed to generate replies that are statistically consistent with what an expert might say in a given scenario, rather than providing true expertise or deep understanding. It's important to recognize their limitations. On the other hand, machine learning began assisting with clinical decision-making in the 70s and 80s. Since then, it has evolved into a collection of powerful algorithms capable of analyzing complex medical data for diagnosis and prediction. For critical clinical decisions, specialized machine learning models are the right choice. And even with advanced machine learning, there are still real-world performance gaps, as these models often perform worse in clinical practice than developers claim, indicating fundamental issues beyond mere validation. In the past, we rushed AI tools into clinical practice, mistakenly believing that high accuracy metrics alone guaranteed real-world reliability and efficiency. This led to disappointing results and eroded the trust of medical professionals, who found that these systems often failed to deliver in actual clinical settings, a loss of confidence that is now difficult to restore. One major factor behind poor real-world performance is when we let models overfit by memorizing data instead of truly identifying medical pathology. To achieve results that generalize well, it's vital to assess the quality of the training process itself, rather than focusing solely on final accuracy metrics. Overfitting during training undermines the model's ability to perform reliably on new, unseen patients. One way to detect unhealthy training is by examining how accuracy evolves throughout the training process, not just at the end. By looking at the shapes and relative positions of the training and validation accuracy curves over the course of training, we can tell if the process was healthy and whether the final accuracy is trustworthy or just a sign of overfitting. So, remember, always look for evidence that the training process was healthy in every report or publication you read. Don't just take high final accuracy claims at face value. As you now know, impressive accuracy can result from unhealthy training, which makes the entire tool unreliable in real-world practice. Some may argue that showing external dataset performance is enough, but developers shouldn't even test on external data unless they've first proven the training process was healthy. If a model boasts 99% accuracy internally, but drops to 78% on external data, that's a clear sign of overfitting. And remember, many so-called external data sets aren't truly independent, so always demand proof of healthy training before trusting any claims. By integrating training dynamics into quality assessment frameworks, we can ensure AI models are not only high-performing, but also reliable. Only assess classification studies that report both training and validation accuracy curves demonstrating convergence without divergence. If a report neglects to show this, it should not even be considered. Consistent and smooth validation accuracy curves indicate healthy training and greater reliability, while unstable curves can signal underlying problems with the model or data. Beware of models that simply memorize data instead of truly learning meaningful patterns, as memorization leads to poor generalization and unreliable performance on new, unseen patients. To learn exactly how to assess machine learning classification models, my books provide clinicians, researchers, and healthcare administrators with practical tools and frameworks for their detailed evaluation. They will help you ensure that any machine learning system is thoroughly vetted before it's used in clinical practice, empowering you to make informed decisions and avoid common pitfalls. Effective AI tools in healthcare require collaboration between developers and medical professionals, as clinicians provide vital domain knowledge for proper data splitting and identifying relevant features, preventing models from becoming useless in practice due to overlooked data issues. Without this interdisciplinary teamwork, AI systems risk missing important clinical nuances and may fail to deliver reliable results in real-world settings. My final message is for educational institutions. Empower medical professionals to actively participate in AI development by providing them with the knowledge and skills needed to evaluate and shape these technologies. Future and even current medical professionals should understand and learn to spot red flags in AI model training, such as overfitting, bias, or poor generalizability. Medical professionals should be active participants in the AI development process to ensure that these tools truly meet real-world clinical needs, paying close attention to how data is split, which features are used, and how validation is performed. Gaining these skills will empower them to collaborate effectively with developers during the design phase, ensuring that AI tools are safe, reliable, and clinically meaningful. I'm Dr. Toma, an associate professor at the College of Osteopathic Medicine, New York Institute of Technology. My journey in this field has been shaped by the collaboration with our outstanding medical students and my background in computational science. Together, in just a couple years, we've published nearly 40 peer-reviewed studies on AI in medicine, which became the foundation for my books, and I am deeply grateful for their partnership and inspiration.